Yes.
Okay. Hi.
Hi, Raja.
Hi.
How are you?
Hi. Good, good. Thanks.
That's
Finally,
good.
we are doing this session where we can help our juniors who are willing to come to Australia and US. So let's start. So my first question is, if somebody wants to come to US as a doctor, how do they start? Is the basic question for everyone.
Uh, right. So, to come to the US, you need to apply for residency. You cannot practice in US without doing residency in US. And to go for residency, you need your USMLE exams, you need rotations, and you need research. And then you apply for residency, which is a 1 year long process. And once you match into residency, you can train and then practice. So to start,
Hmm.
you would need to start with the USMLE Step 1 exam.
Okay. So, how many steps are there until you start practicing there as a doctor in US?
So in exams, we have three steps. That is USMLE Step 1, 2, and 3. And to apply for residency, you only need the first two steps. The third step is optional. You can even take the third step during your first year of residency. But there are three steps, and each all these exams, like the first two steps, are 8 and 9 hour long exams where
Hmm.
you 280 to 320 questions. Each question is case based, and yes, that is how the exams are.
These are the MCQ exams, right?
Yes,
Yeah.
all of these
And
are.
you can take both these exams from India.
Yes.
Okay. So for Australia, we have two exams. First is MCQ exam. There are 150 questions, and it's not very difficult exam. And if somebody wants to prepare for Australia, they just have to go. There's not many coachings, and it doesn't even need coaching for that. So you can get Amadex. There are some questions and recalls, and you can easily crack in like 3 or 6 months of preparation. And then you can apply for jobs. And then AMC2, if you want to do before getting a job, that's good thing because getting a job will be easier. Otherwise, you can start and meanwhile go for AMC2 or WBA. So for Australia, the timeline is like once you start preparing from step one, it usually takes 1 to 2 years. So if year is minimum, and then up to 2 years, almost many people get their first job during this time frame. What about US?
So in US, it is usually like you need 1 year for the exams. That is, you take the step 1, step 2. You also do your rotations. So all of that takes a minimum of 1 year, and then the application process itself is 1 year. So it takes 2 years.
But then 1 year is also
Hmm.
like a very rushed timeline. Usually it takes people about uh 2 years to fully complete their rotations and steps and everything. So, but you can do it in 1 year, but that'd be a very rushed and very close timeline.
Right.
When
So
I was preparing for, I was thinking of USMLE. I had this idea in my mind, like it will take minimum 3 years till
hmm,
I move to 3 to 3.5 because I've seen people struggling to get their, that matching thing, and
hmm,
then it's a very long procedure.
yes.
Is
And
it true?
yes, it is long, and
It is long.
matching is also kind of like difficult, and also like it can take.
Yeah.
I wanted to ask you about AMC. So what I've heard from my friends is that AMC 1 is, as you said, it is relatively easy, but AMC
Yeah.
2 is very difficult. Like, it has a pass rate of less than 50% or
No, the passing rate for AMC2 is 22% last year.
oh wow.
So it's difficult, but in terms like not for the clinical knowledge, it's how you communicate with the patient. Because in India, what we practice is totally different. In this AMC2, there are 16 to 18 stations, and you have to. There's like earlier it used to be like online,
Hmm.
so we have a Zoom meeting, so something like that. There is a actor in front of you, so
Right.
you'll have a situation like there is this patient whose wife has been taken for operation, and and he's cranky now and whatever. So you have 2 minutes to read the stem and then you enter. You have 8 minutes to discuss. So if he's angry, you have to act accordingly. So some people are not very familiar with the situation, and it's your communication, is your little bit of basic knowledge and these kind of situation based things, and you have to pass 9 of 16 stations. So
Okay.
sometimes it can be tricky, sometimes you can pass even without studying, so it's totally luck basis. Yeah.
And so I think what many people do is that they go through the PLAB pathway, that is, they take like PLAB and then they come to Australia. So how does that work?
So there's a competent authority pathway. If you are working in UK for 1 year after clearing PLAB, you can shift to Australia without any exams. So that's a very good option if you are working in UK. But if you are starting your journey from India, then getting a job in UK is also very difficult.
Yes.
And you are wasting 2 to 3 years to get into UK, and then 1 year in UK, then shifting your country, because it's a difficult thing to do. So if you are starting from scratch, I would recommend to start directly go for Australia.
Okay.
Why to struggle UK and then deroute?
Makes sense. Yeah.
Yeah. So okay. So my next question to you is, for Australia, the total expense from zero to Australia is around $16,000 to $18,000. Earlier, it used to be like $14,000, but now they are changing the AMC to face to face. So the flight cost and visa and everything. So it's a bit more expensive. But if we talk in Indian rupees, less than 10 lakh rupees for whole process,
Oh,
Okay.
that is good.
including travel to Australia for AMC2. What about US?
So
Yeah.
US,
Because in US, I was doing some research. It's like 40 to 50. I'm not very sure. Like,
no, so there's a huge range. Like
Mhm.
there are absolute essentials that you will have to pay for, and then the rotations are something that can vary widely. So the essentials that you need are like the exams and certifications. That will be around, all the exams and certifications will come around like $5,000. And then when you apply for residency, that will be another, like, because you will apply to a lot of places, it will come around to another $5,000 to $6,000. So these $10,000 to $12,000 are confirmed. You cannot cut back on them. Now, when you come for
that's
rotation,
US dollar.
yes, US dollars. When you come for rotations, the cheapest way you can do it is you come to US once and then you find 3 or 4 free observerships. You stay there for 3 or 4 months and then come back. So in that case, the flight and the accommodation and everything will cost around $6,000 for 3 to 4
3 to
months.
4 months. Yeah.
That is the cheapest you can do. But there are many places that offer paid rotations, like there are agencies and everything. So these paid rotations can range anywhere from like $1,000 per month to $5,000 to $6,000 per month. But on an average, they will charge like 3 to 4,000. So if you do 3 months, directly $10,000 to $12,000 will get added. So that
The range is really wide depending upon what you do.
So let's not confuse our viewers now, because I was talking in Australian dollars and you're talking in
yes,
US dollars.
Yeah.
Let's give them a like a range
Indian rupees.
Indian rupees.
So
like Indian rupees. So minimum is like how much?
minimum it would cost
Okay.
around like, no, I think we can say roughly it would minimum it would cost 15 lakh rupees.
Roughly, yeah.
Yes, roughly 15 lakh rupees, and maximum it can go up to 35-40 lakh rupees. So
And average, as per my data, what I analyzed earlier. So on an average, like you are going through that route, it costs around 30 to 40 lakhs for one person
yes, 30 to 40
to
is still on the higher end, but we
all
would say
these things. Only.
on an average it would be 20-25 lakhs. 25 lakhs is fair.
Fair enough. Okay, so the next question is Indian residency. If somebody is a specialist in India, in Australia, it doesn't count much, but it gives you an upper edge for job preferences. So if you are a medicine specialist in India, they'll give you a preference in job, but they won't consider your degree unless you're going for specialized recognition pathway. What about US?
Okay, wait, before I answer that, like, I still don't understand how the process in Australia works. That once you're done with the exams, you find a job, but then how does residency look like? Do you have residency, or like, when can you practice independently as a consultant?
Okay, so the thing is, you can start applying for your residency program once you get your general registration. So for your general registration, you need to work for 1 year in Australia. So
Okay.
if you move to Australia with all your AMC1, AMC2 and start working, after 1 year, you can apply for your general registration. The moment you get your general registration, you apply for your medicine training, the BPD training. And BPD training is 3 years. It's interview-based selection. So no exams, just interview, and the selection rate is around 50%, I guess.
Okay.
50 to 70%. So once you get into BPT training, it's a 3 year training, and you have to clear some exams to get your degree, and then you get into advanced training. That is also a 3 year program, whether you want to do it in cardiology, gastro, rheumat, etc.
Right.
So after advanced training, there are no exams. For entry as well, there are no exams, just interviews. And once your advanced training is finished, you become a fellow and you're a consultant.
Okay. Okay. So on an average, if someone wants to like go after MBBS, how long would it take before they become consultants? How many years?
Minimum 7 to 8 years. But if you are going for very good branches like gastro or maybe surgical branches, so on an average, for shorty point of view, just 10 years, keep that in mind. Like 10 years, you have to work as a junior doctor or advanced trainee. After 10 years, you will be eventually a consultant. If you want to be a GP consultant, then the road is easier. So within like 2 year, 2 to 3 years of GP training, so after 4 years, you become a consultant here as a GP.
Okay. Okay. And to answer your question, how does residency in India affect US? So
Yeah.
it can affect positively and in both ways. How it affects
Hmm.
positively is because you already have the specialized experience in the field that you're applying in. So if you're applying for medicine residency in US and they see that you've already done medicine residency in India, that of course helps. But at the same time, what happens is that in US they tend to prefer newer graduates. They'll
Newer
prefer
med school
Yes,
graduates
they'll prefer
specifically.
Hmm.
fresh students. And so usually many
Okay.
places will have cutoffs, like if that is called the year of graduation cutoff. And they say that if
Hmm.
they might not consider people who have an year of graduation older than 3 years.
3 years, yeah.
Hmm.
So that also comes into play. But if you have an older year of
Hmm.
graduation and you can prove
Okay.
that in these years you've like trained and you've done this work and you've added this value to yourself, if you can show that, then it counts as a beneficial thing.
So, so it totally depends on how you present your qualifications to them.
Yes.
It's about the garnishing you're doing.
It's like saying
Same for
if you say old
hmm.
graduate, that is something bad. But if you say experienced
Yeah.
graduate, something good.
So it's something you mold your
Mhm.
CV
Yes.
that they can palette. Okay. Okay. So what's your reason to move to US and leave India?
Uh, so one of the main
Tricky
reasons
question.
one of the main
Yeah.
reasons would be the work-life balance that we get there because we've seen people practicing medicine in India and any specialty in India, and then in general it is much better there because you get paid more for a more reasonable amount of work. So that would be the main reason.
Yeah.
And also the other
Hmm.
I think
That's cool.
academically as well, like the opportunities that you get, especially with research and with certain very cutting edge technologies that we don't have access to as of now, and then the learning process in general is more holistic and more I don't know which other words to use except like Uh, Cutting edge, I don't
Yes.
know, but
So,
like
for
you
example,
get
like
better training that way.
I was on
Like,
my rotation last month, and it was a sleep medicine rotation, and where I saw that they actually practice that thing, the hypoglossal nerve stimulation. So they'll put an implant, and then they'll put a cuff around the hypoglossal
Hmm.
for obstructive sleep apnea. And I saw that being put into practice and like being done there, which we only in India, it's still not there. We only learn it in theory. So you get access to advanced things.
what
Actually,
about?
in India, I did my training from India. The good, sorry.
Yes.
Oh,
What about
what
you?
about
So I
you?
did my training from India.
Right.
Yeah, yeah, I'll tell you. So in India, I learned a lot of things because there are bunch of people with different presentations. So different cases, you become so confident and your clinical skills improve a lot. But if you compare with the advanced technologies and advanced tests and those things, so if you are focusing on the basic things, you're very good with the clinical exposure in India. But now I'm working in Australia. So the different amount of tests that I used to read in the Harrison back then, we are doing that here. So more exposure in the advanced things here. The similar what you said, like hypoglossal nerve stimulation, and these things are being practiced here. We can't, because in India we have to depend on patient's pocket, but here government is paying for everything. The patients are not worried if you want to do 10 MRIs on a patient or maybe bunch of tests. So they don't care because they want to get treated. And people here live for like 90, 100 years, and they're fit like until 80, 90. They are walking with the wheelie
Yeah.
walkers, and it's so good.
Hmm.
Like, you are 60, you're retired.
Hmm.
People are not old until it's 90 or 100-year old. So it's pretty good. It's mostly the government support because government is funding all the investigations and healthcare. That's pretty
I think
fascinating.
that's the biggest difference between US and Australia. In US, nothing is government funded, everything is privatized.
Yeah,
And
yeah,
in Australia, even in UK, I think you have that. Like you have the government is
yeah.
funding healthcare. So that's a really good thing.
In US, the healthcare is a scam. I heard. My sister is in US, and she got all the covers and everything. But the moment she twisted her ankle, she broke her leg,
Hmm.
and she has to pay like 30 lakhs or 20 lakh Indian rupees despite having the cover. So what's the use of that health insurance? And I'm not very sure. I have never practiced or have zero experience of US, but I have heard things.
Yes, so it is very expensive. For example, without insurance, if you get one X-ray, one single X-ray will cost around
Yeah.
to $500. That is like 30 to 40,000 rupees for one X-ray without insurance. So you will need insurance. Insurance will, like if you have insurance from US companies, it will cover a lot, but also
Mm.
have very high premiums, deductibles. So in general, healthcare is expensive. If you have a major healthcare event, it can like take up a lot of your savings and everything will go into that. So it is expensive.
Mm.
True.
Yeah. So if like coming from expense to salaries,
Hmm.
so does it fill to your pockets as a doctor if it's expensive there? Like what are the salaries while you are training and once you are a consultant? So
So
the process, like also if you can mention the subspecialty trainings and
right, right.
because yeah.
So during residency, it does not matter what specialty you're pursuing. All residents will have an average similar amount of pay. It can range anywhere from like 60 to $80,000 per year, but most places will have around $65,000 a year. And per month, if you count that after taxes, in pocket you'll get $3,500 to $4,000 per month. So
Hmm.
that is like you can all your basic expenses are covered and you'll have some savings left but not a lot. And once you become a
Hmm.
consultant, then it completely depends on your specialty. Most international students, they choose to go for internal medicine or family medicine, which pays around 250,000 to $350,000 per year. And if you take like a radiology, then
Okay.
it can go $600,000 even higher.
$900,000.
900.
We just
We've
heard
also
of
heard of
someone,
salaries like that.
but yeah.
Then if you
Hmm.
choose to specialize, for example, if you do cardiology or interventional cardiology, you can earn 600, $700,000 per year. And all of this is like salary based in a hospital where you are not owning the practice. If you own the practice, you start your own private practice,
And
it can
Yeah.
go pretty
yeah.
high.
And if you want to become a cardiologist in US, so what is the duration of BPT and advanced training there?
So it is like for cardiology, it is internal medicine residency, that is 3 years. Then you'll have 3 years of cardiology fellowship. And so that is 6 years. And above that, if you want to do interventional, that is 1 year more. Or if you want to do electrophysiology, that is 1 year more. So
So
that's,
similar to Australia, I guess.
yes. How is the compensation in Australia?
Hmm. So in Australia, as a junior doctor, you earn around like if you're a registrar, you earn around 150 to 180K, and after taxes is similar because if you're working, it's 38 hours a week,
Hmm.
and in these 38 hours, if you're working on a weekend, for example, if you work 10 hours on a Sunday shift, out of those 38 hours, you'll be getting paid for 48 hours.
Okay. But
So
this
that's
is
the
when
beauty of
you're
Australia.
working. This is when you're working as a registrar. That is before residency.
Yeah, yeah. And
Oh,
I'm
wow.
talking in Australian dollars.
Australian dollars, yeah.
So it's around 150 dollars, 150K for a year, I guess. Yeah,
Oh,
yeah.
that
So
is
after tax, like, it's a good amount of money that you're earning. Your working hours are 38. In US, it is
in US
working hours. How many working hours?
residency can go like 60 to 80 hours. But like once you enter private practice, it will like once you finish your training, it is flexible. It can go anywhere, but on an average, 40 to 50 hours.
So the till you are a consultant, you work 60 to 80 hours, and you are getting paid like $50,000 a year, right?
Yes, 60, $70,000.
60, 70 after tax. There's some, yeah. But here, if you are working even for like 40 hours, the extra amount of work you are doing, they pay you double for that.
Oh, wow. That is
Yeah. So
good.
for every hour, you get paid.
Hmm.
So it's very good. It's not like because from my point of view, the residency in US is similar to India. So you are supposed to work hard and you
Yeah.
have to do long shifts and everything. Could
Yes.
be toxic if you are new that working for 80 hours is
Mhm.
huge.
Yes.
Hmm.
So, yes, that is true that it can be difficult. Like residency in general is tougher than once you become a consultant.
But yeah, once you become a consultant, you get paid a lot.
Yeah.
Even here, people are earning in a public sector, the consultants are earning like 300 to 500K. If they practice as a locum in different private hospitals, they can get money from their patients even in public settings because they have rights. They
Hmm.
can bill them as a private consultant as well. So there are different things. But once you're a consultant here, you earn good amount of money.
Okay.
Maybe in US, you might the consultants might be earning even more because the healthcare is way too expensive in US. But yeah.
So the thing is that the like out of the total healthcare expenditure in US, only 10% of the cost is due to doctors.
Okay, I understand. Similar in India.
Yes.
Similar in India.
Yes. Rest of the cost it goes because of administration, insurance,
Insurance.
drugs are medicines are so expensive that medicines that you, for example, the SGLT2 inhibitors like
Hmm.
sitagliptin.
Yeah.
Uh,
Yeah.
these drugs that you get in India for like you get a 30-day supply for 3,000 rupees. That same
Hmm.
30-day supply in US, it will cost you $600.
Hmm.
Like $600 is what? 50,000 rupees. So that's a huge difference. So everything else
Here,
becomes expensive.
but in Australia, every medication is subsidized. So government is paying most of the amount, and you have to pay just like $19 for 3 months supply of one drug, or Australian dollars. So it's pretty cheap here.
That
So people come to the hospitals all the time. So
okay.
that's good.
You mentioned like your pay as a registrar and as a consultant. How does the pay look like when you're in residency or the advanced training?
So if you are starting as an so intern, RMO, registrar, and till you become the consultant, you are registrar. But every year you are a PGY, your level increases.
Right.
So every year they increase your per hour by $1 to $2 or $3, around like $50 per hour.
Okay.
And if you're doing extra work, it's $100 per hour. As I told you, they pay double for extra hours. So starting from 50, then 54, 55, 60, 65, 70, every year it keep on increasing. If you are like level 1 consultant, when you become the consultant, so as a consultant, you earn around $140 per hour, but every year it keep on increasing. And if you are doing locum shifts, it's double. So if you are a consultant and you are coming to an hospital as a locum consultant, they pay you around 280. Like for one day, they pay you $2,500 for one day work as a consultant.
Oh wow, that's good.
So lots of options once you are a consultant.
Okay. One question that a lot of people ask is that what specialties are easier or more difficult for
Especially for surgical, everyone was asking ki how difficult is it to get a surgical branch or OBGYN or something like that as residency. That's something.
Okay, to get into surgical branches, including gynec, it's a bit competitive and difficult. So you have to work for 3 to 4 years in that department as a registrar, non-trainee registrar, to make some links, to gain some experience. And if you're really dedicated and passionate about it, you'll get into that training. But it's not that easy. Some people I've seen working in those departments for like 6 years, still no luck in getting into training, and then they try to become GP and keep going. So it's more of like a struggle plus luck. You can't predict it, but if you're passionate enough, there is no branch that you can't get.
okay. And what are
That's
the
why I said like it's a yeah. So it's that's why I said it's 10 year of
right?
wait. Eventually, like if you are doing general surgery, it's 5 year specialty, and you become a surgical consultant. But to get into gen surg, you have to work for 3 to 4 years. So 3 to 4 years as a non-trainee registrar, then 5 years of training, then you become consultant. So keep that in mind. 10 years, 10 years. That's all.
And what are the relatively easier branches for uh, international graduates to get into?
First, GP. GP is like family medicine. So you get into GP training. The GP is the easiest one.
Okay.
Once you are here and you GP, there is like a good selection rate. They love GPs. So if you want to become a GP, they'll totally support you. And the training for GP is 3 years. Then you become the GP consultant, and passing rate is 70 to 80%.
Okay.
Okay.
Oh,
So
that's good.
That's good.
yeah. So and if you are a specialist in India or some experience, then you can tell them, and they consider cutting it down to 2 years as well, called recognition of prior learning. So in 1 year of training to get your general registration, and then 2 years of training, you can become a GP consultant in 3 years. And then comes emergency, gen med, and geriatric medicine after gen med.
Okay.
Like medical branches are bit, and then comes the surgical branches.
Okay.
Okay.
So I think it's similar for
Similar to
US that in US surgery would be more difficult, not impossible, but it will definitely take more time. That you'll need at least 2 to 3 years to prepare for the residency application, and then the residency itself will take like 5 years. So general surgery residency is 5 years or like 5 or 6 years. I'm not
Something
sure,
like
but
that,
the
yeah.
residency itself is also long,
Same.
and so it will take it is not impossible, but it does take a lot
And
of effort and
it's
time.
just like you said, it needs that passion.
Yes.
Surgery, even for US, if you show passion, then it's not impossible, but it's also tough because you have to show that.
Yeah.
Like,
And
So yeah.
and similarly, the medicine branches are like relatively more IMG friendly, like family medicine, internal medicine.
Yeah.
Pediatrics is IMG friendly.
pediatrics.
Then you also have non-clinical branches like pathology. So that
Hmm.
and anesthesiology is also relatively IMG friendly.
Anesthesiology, I've heard, is really
And anesthesia is tough. Anesthesia is tough because it pays really well if you're
Yes.
an anesthetist.
Yes.
So on the tougher level, not as easy as medicine,
Yeah,
but
Yes,
not tough.
but
exactly.
somewhere
So
between medicine and surgery.
yeah,
Psychiatry also
yeah,
the same, somewhere between medicine and surgery right
yes,
now.
yes, yes. But
So
psychiatry easier than anesthesia. So I think the situation is similar in US and Australia in these
yes,
terms.
in terms of difficulty. Okay.
Okay.
One other thing that a lot of people wanted to know was, well, how have your 6 months been there, and how is the work environment and everything in Australia? Because you have like first-hand experience now, so.
Okay. So I was nervous coming here because in India we had lots of experience, but the system here is totally different. I never heard about occupational therapy. It's so, so lots of new terms I was learning, NDIS, and there's like insurance and nursing home. So I was a bit nervous, but after coming here, after working for 6 months, these things become very common. Second thing, I was very good with the procedures in India, and I was worried. Okay, the procedure. So even for ascitic tap, you did your MBBS from India, right?
Yes.
So how we used to do, like Z technique, you clean the area, Z technique, and intern used to take the samples. But here they'll scrub in and all the pigtail, and it's so fancy. I used to like, okay, how to do that? And the chest tube was so scary in India. You clean and then you like go like this and painful.
Hmm.
So, but here the procedures look scary, but they're way safer than in India.
Hmm.
So for chest tube, you're doing ultrasound markings, and then you're doing ultrasound, and then going with a small pigtail, and patient won't even feel pain. You give local anesthesia, subcutaneous Fenta, and the procedures look scarier, but once you start doing them, you're good with this. So I have done many lumbar punches here, chest tube insertions, and ascitic tabs. So these procedures that I used to do there, so I have that clinical sense now, but with the fancy equipments here.
Yes.
So that's a win-win situation. And if you are so, even many IMGs ask me this question, Doc Saab, we don't know how to intubate, and we don't know how to put chest tube, and how we're gonna perform it. They don't have to worry about anything because the support system with your senior here is very strong. Secondly, nobody will ask you to intubate. They have a separate team for this. Okay, they'll just throw a med call, and anesthetist will come and okay, go for it. So at a junior level doctor, you are just supposed to do the cannulations. You should be good at it. Even if you are not good, they'll make you good.
Yes.
You'll learn everything.
Nice.
Right. And one very important question. How is the visa situation? Because in US, it takes a lot of time that if you are moving to US as a doctor, and if you don't have any family, or like you are coming purely on your training visa, and then you are staying there, you are getting converted to work visa, and then you become a green card holder, and then you become a citizen. And once you become a citizen, after that, you can call your like parents or your family to US. And all of that process takes at least like 15 years, to say the least, 15 to 20 years. So how is the visa situation in Australia?
Okay, I'll tell you a proud feeling. Visa here is way easier. I got my visa in like 2 months. Second, once you start working, the moment you get your journal registration, you can apply for PR, and it will come in 3 to 6 months. This is for me. And if I get my job here, they'll give me work visa, and my family and kids, they'll also get the same. Well, like they'll also get the dependent visa with me. They'll come with me.
Right.
Second, for my parents. So I've been working here for 6 months. I applied my for a visa for my parents last month. they already got for 3 years. Multi-entry visa, they can stay with us for 2 years in those 3-year visa. So no complaints.
Oh wow, that is very good. And like once you get your PR, how long?
Parth and Preya,
Yes. Yes. You were saying?
listening to me, I think you guys might change your mind coming to Australia.
No.
All the-
But this is very good. I think,
you already.
hmm. But the visa thing is definitely very good. And like once you become PR, how long does it take for you to become a citizen?
That I am not very sure, but they love doctors. So if you're a
So,
doctor here, you don't have
Okay.
anything.
hmm.
5 years after getting PR. So after PR, 5 years to become a resident. Okay. I have a
So,
backup. I told you in Australia, you have a good support
yeah,
in everything.
that's
Yeah.
right. Okay. So we do have a lot more questions, but do we want to end this session here or do we want to continue? You can let us know.
Okay. So let's just do this thing. We can let our viewers comment on this video, and if they want to ask us any further, because I don't want to post a 1 hour video and
Yeah.
getting no response. So let's just wait for them, and I'm happy to do one more session with you guys, and we can discuss, interview each other, and people can get clear views about Australia and US.
Yeah.
How does that sound?
Yes, that
Sounds
sounds great. Thank you so much for having this conversation with us.
Yeah, it was lovely talking to you guys, and I hope the audience will love this webinar or this interview session, whatever we call it, and let them decide. And do you have any questions for our audience so that they can comment apart from their questions for us?
So, what questions can we ask our audience?
I have one
Would you
question.
prefer like UK or Australia? What does the audience think is the better way to go?
Yeah, even I have this question because I personally liked Australia. That's why I moved here. And we didn't talk about UK. So how about US versus Australia? Let them decide
Yes,
and
versus.
say.
Yeah.
Okay.
So comment below and see who wins. And if people decide US, then I might be moving to US. And if they comment Australia, you guys come to Australia as well. Okay.
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 See you.
Awesome.
Okay. See you guys. Nice talking to you. Bye.